Hello everyone and welcome to our specialists presentation of the packages of care for ProEducation. The specialist team at ProEducation have put together an integrated approach to therapy, and we would like to talk to you about that today, and that will be myself, Hannah, the speech and language therapist.
Hi, it's Mr. Igor, the occupational therapist.
And I'm Rachel, the school counselor.
So during today's discussion, we're going to be talking to you about how we traditionally delivered therapy at ProEducation, and then we're going to talk through this packages of care approach, discuss what the research has said, what this will do for the therapy of your child, and our plan for implementation. So the current research says that therapy outcomes are found to be more successful when applied across multiple environments with multiple communication partners. And what this means is that we should be practicing therapy and practicing skills in lots of different settings with lots of different people, rather than in the more traditional pull-out one-to-one therapy sessions. And we're hoping that packages of care will help us to achieve this.
What we've been delivering up until this point, students are mostly accessing one session of input from each specialist, and these sessions last 30 minutes. SLT and OT are also spending time in the Towards Independent classrooms, and this is what we've been doing up until term 4.
So what we're proposing and what we're implementing now from term 4 is this integrated treatment approach. This will consist of one-to-one therapy, paired therapy, group therapy, as well as class-based interventions. And this gives opportunities for more students to access our specialist input. This also gives opportunities for our current caseload to practice and learn the skills with their peers and in different settings. This follows best practice research and also provides us with many more opportunities to upskill and train our national teaching staff.
Looking at the numbers, we have counted and found that 51 is the number of contacts that we had with the traditional approach across all of SLT, OT, and counseling. So we were seeing students for 51 contacts per week. Whereas if we're doing this packages of care approach, we're actually increasing threefold these numbers. So we would be having 174 contacts per week with the students. And that is because we're seeing more students, we're offering multiple groups where multiple students might be participating. And so overall, we're really increasing the numbers across the whole school.
So how will this be achieved? The specialist team will meet and listen to feedback from the teachers to identify the needs of the students in the school. We will then create appropriate groups and, where possible, put the students together if they have shared targets. Some of the students will still access paired or one-to-one therapy, or they may just be seen in the classroom by a specialist. At the beginning of term, a baseline will be taken of the current skills, and then through the term we'll be targeting those specific skills across these multiple therapy settings. At the end of the term, we then review this by repeating the baseline and seeing the progress that your child has made before deciding what package of care they will access in the next term. So the different packages of care that we will offer will include one-to-one or paired therapy, and this will be given where a group cannot meet the needs of the student, or the student requires to practice skills first one-to-one with a therapist before transferring into a group. Some students may also benefit from multiple packages of care where they would access one-to-one as well as a group and potentially also be seen in the classroom. Group therapy is also to be offered as there is an evidence base for some skills to be practiced in these settings. The students therefore benefit from peer interactions and modelling from their same age or older or younger peers. The targets can then be worked on alongside others, which leads to more generalisation. Peer support and recognition of mutual goals is also an important aspect of groups, as it allows students to see that they're not the only ones struggling with this skill. Class-based interventions are also offered where the skills are best worked on in the classroom setting, or they need to be taught in the context in which they're used. This is also a great opportunity to co-teach with our national staff and to apply therapy approaches in the classroom.
So why is this beneficial? Ms. Hannah just mentioned that word generalization. The child now, hopefully with this approach, is independently applying the skills that have been taught in therapy. So if a child performs something in our therapy room, we might call it magic. You never see it. However, if it is generalized, you see it at home, you see it in the classroom setting, you see it in many places, then it's progress. Then we're really seeing these children grow. And so therapy skills practiced in these multiple contexts will be leading to generalization, and practice with multiple people as well will contribute to generalization. So then we're using these skills in the classroom also, and that is resulting to you seeing it at home and many other different environments that we might have. So what does this mean for my child? Well, if we look at the graph here, it's showing the numbers that we calculated, that the number of sessions will really be going up exponentially. If we look at all of the 3 specialists with the OT, SLT, and counselor, these numbers in white show how much more contact we would have with the students. So based on the data we were able to put together, attendance would happen for most of the students in more than one group, and the classes might be co-taught with the SLT and the counselor, or perhaps with the OT as well. So many students that had no input from the specialist before will now have specialist time, as well as the ones that are currently receiving therapy might see more of the therapists. So an example here, to take you through many of the groups that we might be running, is the lunch club, delivered by Ms. Hannah and myself during lunch in order to work on some of the fine motor skills using different forms of cutlery and different forms of eating approaches, and at the same time working on communication. We will come up with a theme or topic weekly and to guide the students to tolerate sitting at the lunch table for 20 minutes and showing us sustained attention.
Another group that we'll be running this term is a self-esteem group. We will have 2 groups split according to ages, and this will help students feel more positive about themselves, and we'll be able to discuss together different life events that have perhaps created a negative self-image. We'll also be able to explore and discuss strategies to help build their confidence. This group will take place during homework club from 2:15 to 3.
One of the groups that we'll be running is Smile Therapy, which is an evidence-based intervention for functional communication skills. This intervention breaks down the small steps needed for simple tasks that we might not think about as adults, but is very difficult for some of our students. For example, going and getting something from an office. Does the student stand in the right place, open and close the door quietly? Can they wait if the person they need to speak to is on the phone? So this group will be run as part of the school day with our TI3 cohort. Attention Autism is another group that's going to be run as part of the school day with TI1s. So this will target joint attention, turn taking and sustained attention by using really fun and motivating activities to help the children orient to an adult and also pay sustained attention, which is the first stage of communication.
Stress management is another group that we'll be running with the counselor and the OT. This takes place near the end of the day, so we're not taking the students away too much from their core subjects. We're targeting students with routine life stressors, giving them some strategy to cope with these stressors, and allowing them to recognize that they're not alone, that many other students share these problems. And so we're empowering them with the skills to take control of their emotional life, and we're doing a lot of sharing, which is great for peers of this age.
Vocabulary group is another group that will run during the homework club time, and this will choose topic-specific vocabulary and help students to pre-teach and overlearn this vocabulary to use in the classroom. This will give them the skills to be more confident when they approach new topics with new vocabulary.
We will be using a handwriting group to deliver to students who need to improve legibility, some of their spelling, some of their phonics, and mnemonic strategies to give them additional tools in order to improve their writing style. We will aim to improve their grip and their posture mechanics.
Visualizing and verbalizing is another evidence-based intervention that will be running in homework club time, and this uses barrier games to describe pictures, to build on expressive language skills, theory of mind, so that's understanding that someone else doesn't know what's going on in your brain, and also to help the children build up expressive and receptive vocabulary skills.
A group that we will hopefully be running in the future is obstacle courses. So for some of the students that have motor deficits or that have balance abilities that are maybe a little weaker, we will address core training and the ability to perform cross-lateral tasks. So this will improve that gross motor functioning and the coordination of their upper extremities.
So where can you find more information? If you follow these links on the page, then this will take you through to some of the research articles we used to put together this proposal of packages of care. Alternatively, you can always come and speak to the specialists in school. If you have any questions, please do get in touch with any of the specialists, and we'd be happy to meet with you to go over the package of care for your child. So come in anytime and just ask to speak to either the speech and language therapist, occupational therapist, or the school counsellor. Just a final word to say, we really believe that this approach brings the most benefit to your child's therapy. We aim to put the needs of your children first in all of our actions at ProEducation, and your child's progress is paramount to all members of staff at this school. We're really excited to implement this approach in Term 4 and see the positive changes to our students. Thank you for listening.